tonight's meeting. Thank you for being here, and I will call the meeting to order. As always, we will start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Item C, action on agenda. Are there any additions or corrections to the agenda, Mr. Don? Thank you. Is there a second? I second. There's a motion on the floor from Rick, seconded by Jen, to approve the agenda as presented. Any discussion? All in favor, say aye. Aye. And opposed, nay. Motion carries. Item D, action on minutes, which are in your board packet.
I'll make a motion to approve minutes for the regular meeting held on May 4th, 2021.
Thanks. Second. Thanks, Jen. There's a motion on the floor from Jen, seconded by Dave, to approve the minutes for the regular meeting held on May 24th, 2021, as presented. Any discussion? All in favor, please say aye. Aye. And opposed, nay. Motion carries. Item E, action on vouchers.
Mr. President, I will move to approve general checking account vouchers totaling $918,924.27, and building fund 49 vouchers totaling $1,808,349.13, as presented.
I'll second that.
There's a motion on the floor made by Joe, seconded by Rick, to approve general checking account vouchers totaling $918,924.27, and the building fund 49 vouchers totaling $1,808,349.13, as presented. Any discussion? All in favor, say aye. Aye. And opposed, nay. Motion carries. Which brings us to item F, public comment. And again, I will, just so we're all clear on public comment, I will read a statement. So before we begin the public participation 7130 or another applicable policy. I might recommend that in case it goes slightly over 15 minutes, we should be able to get through all of these relatively shortly. But just in case, is there anyone who would want to make a motion to extend it beyond 15 minutes if it goes?
Mike, you said there's 5 people that have signed up?
5 people and 1 short video.
I don't have any objections to allowing all 5 speak. I have a motion to that effect.
My husband's trying to watch the live now.
Sorry, I'm sorry, David, can you repeat?
That's okay.
I have a motion to allow all 5 people plus the reading of the written commentary.
Thanks. There's a motion on the floor made by Dave, seconded by Rick to allow all 5 people signed up for public participation plus the 1 email to be read aloud. Is there any discussion? All in favor, say aye.
Aye.
And opposed, nay. Motion carries. We will start with Tracy Hannah. And there's a microphone on either side of the room. And again, just a reminder, if you could state your name before you get started.
Absolutely. My name is Tracy Hannah, and I'm a student at Northside. Thank you for the opportunity to speak tonight. I come tonight to ask this board of elected officials to vote to end the mask mandate immediately, support mask choice, and to end Superintendent Allen's emergency powers with regards to COVID precautions. It is you who we vote for, and you who were elected to speak for us, and we ask that tonight you take that power back. I've been coming and speaking for my son for almost a year now, advocating for mask choice. Tonight I tell his story from his point of view. I'm a 12-year-old student who has always loved school and never missed a day without very good reason. I'm a 12-year-old student who loves his teacher and his principal. I'm a 12-year-old student who struggles learning remotely and could not stay home even though it meant wearing a mask to go to school. I'm a 12-year-old student who has a medical condition to where wearing masks for prolonged periods of time makes me feel like I'm suffocating. I'm a 12-year-old student who was willing to wear a face shield in class last year when Mr. Donan initially approved them for classes. I'm a 12-year-old student who was devastated when our governor removed the ability to wear face shields in class with no explanation. I am a 12-year-old student who has a medical condition and who in August of last year went to my doctor and received a medical exemption to the mask policy that stated due to a medical condition, I should not be wearing a mask for extended periods of time, and that the mask should only be required when in close contact with others where I could not appropriately social distance. I'm a 12-year-old student who sat 6 feet away from my classmates and didn't change class during the day, not even for lunch. I'm a 12-year-old student who was told that my medical exemption was not specific enough, and I would only be permitted mask breaks during the day, where I could leave the classroom and remove my mask and walk alone in the hallway where my fellow classroom mates continue to learn. I'm a 12-year-old student who had an amazing teacher who took me outside on occasion so that I could have a mask break and not be alone. I'm a 12-year-old student who went back to the doctor in January and received another form that read, I should not be wearing a mask when seated at my desk and appropriately social distance from others. I'm a 12-year-old student who was told again this was too vague and would only be allowed my mask breaks. I'm a 12-year-old student who stopped taking mask breaks as I didn't want to stand out to the other children. I'm a 12-year-old student who saw his standardized test scores fall when I was forced to stay home 16% of the school year and work virtually. I'm a 12-year-old student who prayed every night to remove mask mandates and to go back to school with no virtual. I'm a 12-year-old student who saw my classmates sent to the wall for removing their masks when outside. I'm a 12-year-old student who, for the most part of the year, had to hide when outside to remove my mask so that I could breathe and not be sent to the wall for punishment. I'm a 12-year-old student who plays baseball in Janesville and had to watch as my teammates found out mask choice was voted immediately into their school, but mine was not. We have to wait. I'm a 12-year-old student who knows that mask choice is everywhere around our community except in our school. I'm the mother of this 12-year-old who will continue to stand for my child and all children like him in this district at each and every meeting to show him that important things are worth fighting for. Some would suggest that my personal story and my request on this board tonight to vote for mask choice is selfish. I disagree. My choice to have my son wear a mask is my choice. Your choice to have your child wear a mask is your choice. They are one and the same. Choice matters. Thank you.
Thank you. Next is Amy Holden.
Hello, I'm Amy Holden. In the beginning of this pandemic, we all did our part to stop the spread. Every lost life is heartbreaking. Over a year later, we have seen much improvement, and Rock County is doing excellent as far as numbers. Our hospitals have closed the majority of its, if not all of its COVID units. There is no longer a health emergency, and the public is free to go without masks, yet our children are still held hostage by a recommendation of it. There are currently 240 school districts in the state of Wisconsin that are face friendly. We want ours to be. As a mom, when you feel there has been injustice against your child, the quiet little me becomes a mama bear. I've known some of you for a long time, and I found it very difficult at times to contain how upset I was that my children's health didn't matter. Both of my children struggle with medical conditions in which the mask at times was extremely difficult to bear. Having their medical exemption denied was very upsetting, to say the least. Having it denied a second time for summer school was just as upsetting. After the staff was fully vaccinated, I found it very perplexing that the stringent protocols continued. Our group formed because of this. This is why we are fighting and begging for the freedom of our children to breathe freely. We are not doing this to take away others' right to choose. Parents should have the freedom to choose what's best for their child. If they want to wear a mask, wear one. You have been bombarded relentlessly over the last month on this matter. Thank you for taking the time to read my emails and others, even if you didn't agree. Please know this was never personal. Now that you are all present, and we think you know that you are, we want to hear what you have to say on the matter. Thank you.
Thank you. Next on the list is Emmy and Gina Gilmer.
Hi, my name is Emmy Dewar, and I will be going to 7th grade this fall in Mountain School District. I am here to tell you about some of my experiences this year and why I think masks need to be a choice in school. There was a time I was 6 feet away from my friends outside and was sent to the wall by a teacher for having my mask down. The teacher yelled from across the basketball hoops and the volleyball net, "You're out. That's where you stay for the rest of recess." Or, when I was outside for my mask break, walking the track with some of my friends, my teacher approached us and called us grandma killers. That happened more than once. There was no one enforcing the rules outside of me getting up here, so I was really confused when the teacher started abruptly enforcing masks. We would have to play kickball in the gym for PE when it was raining outside, and wearing masks made it really hard to breathe. I would end up getting a headache that lasted all day and distracted me from learning. There were also times in my classroom when I thought my teacher was upset with me, when really I just couldn't see her face and her expressions. It's been a hard and confusing year for me and my classmates. Has anyone asked all the kids how masks are affecting them? I think you need to do that. Same.
Hi, my name is Gina Doomer. Annie is one of my 5 children we have had gone through or are in the school district. I am so proud of her braveness for coming up here and sharing some of her experiences and thoughts from the last year. I know you just heard her 1.5-minute speech, but I've had to live this year with her, with all my kids. The tears, the headaches, the washing of these dirty rags they walk out of school with on their face, the emotional toll it has done, not being able to see friends and teachers' faces, the mask shaming, I have lived it. And let me tell you, we have made the most of it because our family motto, the Doomers do hard things. But it is time for a change. I get it. You have numerous parents concerned about all kinds of things for their children in this issue. Some are concerned with asthma, some COVID, others their children's mental health. Some are very concerned with breathing in their own bacteria. That's why we need mask choices in school. Parents need to decide what is best for their children. Thank you so much for your time and hearing us tonight.
Thank you. Next is Tiffany Sura.
My name is Tiffany Sura. I have 3 kiddos. My oldest is 5th grade, Northside. I'm not a public speaker. This is very uncomfortable for me, but I'm here today for my children and for people that I know that can't speak up and want to speak up, so that's why I'm here. We know that children don't become infected with COVID-19 as often as adults. In fact, children ages 0 to 19 have a 99.997% chance of survival if they contact COVID-19. If you look closer at the deaths that have happened and the data surrounding that, it's even more eye-opening. As of June 4th, on the CDC website, under the tab comorbidities, it shows that 1,057 people ages 0 to 24 have died. On that same page, in small print, at the top, it states 95% of the 1,057 deaths had something else listed on the death certificate. An average of 4 comorbidities, besides COVID, are on the death certificates. Pneumonia, suicide, car accident, heart attack. Only 5% of the 1,057 deaths had COVID only listed on the death certificate. That is 58 people out of 100 million. As a former pediatric mental health professional, I can assure you that we have lost many more than 58 individuals to mental health struggles, to suicide due to the lockdowns. This virus is survivable. It is time that we give parents the choice in whether or not to mask our children. In the last meeting, you had called on Sarah Stuckey to address the school and the ability for the Milton School District to social distance the students. She had said that Milton School District had the ability to social distance. We ask you that you vote tonight and follow the 240 school districts in Wisconsin that have voted for mask choice. Thank you.
Thank you. Next on the list is Mike. Is it Moran? I'm sorry if I pronounced that wrong. Darren. Thanks.
All right, hi, my name is Mike Barrett. So when we started out this pandemic, it was, I'm asking for you, or you're asking for me. It was you're part of something, you're helping people. And what this new policy of if you're vaccinated, you don't have to wear a mask, that's turning into it's a vaccine issue now. You're now turning it into if you are vaccinated, you can be free. You don't have to wear your mask. But if you're not, you have to still wear your mask. So I have this leeches book. It's just like this leeches where everybody wanted a star, and then it turned into we don't want the star, and then people start paying for getting rid of the star. And so it's pretty much saying if you're vaccinated, you can get rid of your star. And so here we are with the letter that was sent out to parents last week, June 8th, reporting here, and I quote, with 4 COVID deaths in Rock County over the previous week, we are reminded of the continued serious nature of this pandemic. And that is to show that we need to continue masking our kids. I thought, I have statistics here. As of today, there were 7,206 total COVID deaths in Wisconsin. 97% of those deaths are over 50 years old. And so what I'm wondering is what the 4 deaths in Rock County have to do anything with kids being masked at school. And then also in that letter, it says it's only good until August. So it's really, you're leaving yourself open to make this tyrannical policy again. And what you're doing is you're pushing people to take a vaccine, having their kids take a vaccine that they have a 0.0 chance of dying from. I'm not going to say specific statistics, but I would be willing to bet that children have a higher chance of dying from the vaccine than they do with COVID. And so we do know that the COVID has been devastating to the elderly. But that is not what this school board is in charge of protecting. You're in charge of protecting our children, and making it to where a vaccine allows them to be free is not good on both kinds. We need to give parents the choice. Thank you.
Is there anyone else who signed up that I missed? Those are the names I have on the list. All right, and I will read the email which comes from Joseph Rasmussen. It's very short. Number 1, no unilateral power for superintendent. Number 2, mask choice. All right, moving on to item number 2, the superintendent update. Mr. Dahman will let you give us the update on the forward plan.
A few things to update the board on regarding the COVID plan. The COVID update, the number of positive cases across the district per 10,000 residents has stayed consistent for the past 5 weeks. It has increased in some neighboring districts. Our district, in comparison to those, is the work focused on the AIDS, so we're about in the middle. And again, that That's for total residents in the school district. That's not specific to our students.
Excuse me, Superintendent, sorry, it's really hard to hear you over here.
Maybe get a little closer to the mic.
Sorry.
We put out on June 3rd our dashboard. In that dashboard, as of June 3rd, there were 0 students with positive COVID cases and 1 staff that had an active positive case. There were 13 close contacts from school among the students and 13 close contacts from out of school among the students. There were also 2 staff members that were quarantined because of close contacts from outside school exposure. The latest Rock County Hospital metrics, there are currently 6 COVID-19 patients in Rock County hospitals as of June 8th. One of the hospitals reports a critical staffing shortage, and one reports being at peak census. The vaccine continues to be distributed amongst community members. Over 77,000 have received their first dose of the vaccine across Rock County, and over 67,000 have received their second dose. Rock County Health Department did report that the level of vaccination rates that are starting to level off means it's unlikely that herd immunity will be reached anytime soon, both across the county and across the state. We did work with Rock County Health Department to provide a vaccine clinic for 12 through 17-year-olds once that was available for them. That took place at Linton High School. The first clinic was on May 19th, and the second was on June 9th. There were approximately 200 vaccines were given at that time. And those students from 12-year-old to 17-year-olds who received their second dose on June 9th will be considered fully vaccinated 2 weeks after that. So on June 24th, that group will be fully vaccinated. As of June 11, for our school district, 41% of the 12 through 18-year-olds have received 1 dose of vaccine, excuse me, I have a typo there, because I said 41% for both. I would have to look back at my notes because it wasn't 41% for both. Rock County Health Department anticipates that the vaccine will be available for those under 12 years old in late summer or early fall. On June 8th, I informed parents and staff that as of July 3rd, we'll move to a mask optional approach. This date of July 3rd was chosen because it both gives our 12 through 17-year-olds the opportunity to be fully vaccinated, and that also honors the message that we gave to staff and families when they signed up for summer school, that face masks would be in place for the first session of summer school. And currently in summer school, we have 972 students from 4K through 12th grade. 633 of them are in 4K through 6, and 339 in 7 through 12. So open it up to any questions or comments from board members.
So with the distancing and mask policies in place, where is the close contact issues happening? I know you had mentioned there were, 13 close contacts in the last report, is that correct? I just want a better picture of where this is occurring, because we have social distancing in the classrooms and on the playgrounds and such.
There were, in the last dashboard, there were 10 close contacts from school and 13 close contacts from out of school for students. So the close contacts are happening both in school and outside of school. In school, it more typically would happen in the classroom or in the lunchroom. Part of it is what makes someone a close contact. Someone who's a close contact with someone that tests positive, if within the 48 hours prior to their having symptoms, they have been within 6 feet of that person for 15 minutes or more. So while we do our best to encourage and provide opportunities for students and staff to be physically distant during the school day, we know that in all of our classrooms, it's not the case that everyone's physically distant all the time. In summer school, we have more ability for physical distancing, but not complete ability for physical distancing. Many of our summer school classes are outdoors, and students are able to spread out more in that case. But even for our indoor classes, there are some times when students are in very close, students and staff are in very close physical area with each other. Did that
Yeah, no,
answer what you
if nobody else has a question, I have a follow-up. What is the defined metrics for Milton to remove all parameters in regards to COVID?
I'm sorry, can you ask that one more time?
Yeah, what is the defined metrics for Milton to remove all parameters in regards to COVID? What, are we looking for a specific number, or is there kind of a plan that was, I know last year when you put together the Milton Forward Plan, you had phases, but I noticed on phase 3, there weren't really any numbers or specific parameters given other than Rock County Health Department.
To remove, I think part of your question was to remove all of the safety protocols. So the safety protocol that we have in place right now include the face coverings, the physical distancing whenever possible, encouraging students and staff to wash their hands as much as possible, to stay home if they have symptoms, and to monitor their symptoms. And those are in place and will remain in place based on the guidance from the CDC, DHS, and Rock County Health Department. We are still in a pandemic. There's good signs as far as the decrease in the number of positive cases, especially among those who have been vaccinated. But we can't decide that COVID is gone. We look to the guidance from Rock County Health Department, DHS, and CDC, and make decisions about moving away from any of those safety protocol based on that guidance is the direction that we take.
Thank you.
Other questions, comments, thoughts from board members? If not, that's everything that I have for my update.
Thank you, Rich. We will move on to item B under number 2, discussion and possible action on face covering protocol.
I guess I would start with a comment. As we looked at the fall, through Thanksgiving, and as cases were, I'm sorry, is that better? As we were moving through the fall and cases were growing, we stepped back and heightened some of the precautions that we were taking. And I think at the time, those made sense in light of what was in front of us. Currently, Rock County dashboard has 102 active cases in the county, approximately 160,000 people in the county, which would be roughly 0.06% of an infection rate. I think in light of, for example, Sarah Stuckey's comments last time regarding the ability in summer school to provide social distancing, the ability to still use protocol within the Milton Forward Plan, such as hand washing in case of summer school, classes that are in an outdoor environment and reduced capacity in buildings, that it would be my preference that we craft a way to step back from the mask protocol as it stands today into a mask optional environment. I have a draft in my mind of a motion here, but I prefer not to make it until everyone else has had a chance to chime in. And certainly I'm happy to offer it after everyone is, again, given the same opportunity I had here to comment.
So, just to be clear, you did not make a motion.
As of now, no, I am prepared to do so, but as a courtesy, I'm happy to let everyone else here have the same opportunity to speak as I have had.
Rich, can you let us know what other schools in the county are doing right now?
I can share what some schools are doing. Some schools, I'm not sure what they're doing with this regarding summer school. I do know that last week, Janesville School District made a decision to move to mass optional protocol for the remainder of their summer school. And I do know that in speaking to contacts at the Edgerton School District, they are looking at that tonight, but the information that I got from there is that they likely would make that change as of July 1st. Other districts across the county, I'm not certain on where they are for summer school, but I'd rather not speak to it without being certain.
I would like to point out to the board members that we currently do have a policy. It's policy 8450.01, which does indeed give our superintendent, the district administrator, the power and permission to make decisions such as the masking decision. There's been a lot of emails received and discussion about it's the board's job. The board makes policy. There is no policy about masking in the hundreds and hundreds of policy that we have. But there is a policy, and again, it's 8450.01, which gives Rich, our superintendent, permission and the power to make these decisions. The reason we do that is because if we're going to pivot every time and it's going to be based on a board vote, we're going to be having board meetings quite often. And right now, we only have board meetings about every 2 weeks, and in the summer, it's less than that. So, for whatever motion is made, I think it's important to remember that that policy exists.
All right, I'll go next. I feel a little anticipation on some folks' part. I know this was debated 2 weeks ago. I was not able to be at that meeting. You all know, of course, we had a motion or a potential action end up in a tie, so that nothing changed. I've had a lot of folks reach out in the interim. Some asking why it wasn't there, some speculating on why it wasn't there. That's not material to any of this discussion at all. It has given me a couple of weeks to take input from folks, and thank you for all of that, for the emails, etc. I want to point out a couple things that I hope are obvious. While you folks are right and passionately so about what you want for your particular situation, your child, your choice, please remember that other folks on the other side of this issue are equally as passionate and equally right in their own choices. We don't hear quite as often or quite as vocally from some of those folks, but nonetheless, they weigh into this too. Whatever choices we make here affect more than our students. They affect the rest of the families of the students. They affect our staff. So I take a great responsibility in weighing all of those factors before we choose to do something, if we choose to do something. I will admit, this is very, very challenging for me for a couple of reasons. And I will tell you now, because everybody's waiting with bated breath, I favor mask choice. But I think we have to be careful how quickly we move toward that. I do feel an obligation to folks that made choices based on conditions and requirements that we had in place when they made those choices, i.e. summer school. If the board were to choose an action tonight that would change something effective tomorrow, I don't feel that's fair to the folks that made those choices back when they did. I favor mask choice sooner than later. I don't know if some sort of a date between tonight and July, I believe our current policy is in effect until July 3rd. Some date between now and then strikes me as a compromise. I don't know if that's going to make very many folks happy. But I do feel like personally to make a choice tonight that would change something for tomorrow is probably unfair to people that have made those choices and commitments, so. I guess I'll pause and might have additional comments should we get a motion on the floor, but wanted to let folks know, at least at this point, what I'm thinking.
I agree with Joe. He was talking about the summer school issue. Every single student and family that signed up for summer school signed up knowing what the mask policy was going to be. Same can be said of any staff member that signed up to work. Some of them might have signed up to attend summer school or work at summer school because of that mask policy. I also very strongly believe that any discussion about masks needs to include a discussion about those who have not yet had the chance to become vaccinated. We have lots of kids who have not yet had that chance. There's also been a lot of talk and emails about people who don't trust Dr. Fauci or Dr. Walensky or the CDC or whatever they have to say, but I would ask those people to maybe look at what the American Medical Association has to say, or the American Academy of Pediatrics. They have a lot of good things to say. And like Joe said, there are two sides to this. Like there are with almost anything that comes before us. So I think we need to listen to both sides. Yes. There's no motion yet, but I'm in favor of just keeping with what Rich came out last week with. And I'd also like to thank him for that, for all the time he put into that. So. That's all.
Jen, did you have any thoughts?
Obviously, 2 weeks ago, I was in favor of removing the mandatory mask as well. Like Dave mentioned, it was summer school. I felt that students could be outside. Sarah mentioned that they could be socially distant. And again, I felt that the CDC was going to make some changes, and they did shortly after we met a couple weeks ago. I was actually very impressed with the decision that Rich has made. I felt that his letter was very well thought out, and I think it was an educated decision, and truly a compromise. For, again, as the gentleman has spoken already now tonight, that some folks have indeed signed up for summer school knowing that mask, social distancing was going to be all part of that experience for their children. I also just have to reiterate to perhaps the folks that again are here that you also had that same choice. So that, again, you understood going into summer school that masks were going to be mandatory. I'm a bit disappointed that the county has, in a sense, basically opened back up and felt like they did the districts in our entire county a disservice by not just including the districts in their decision-making. I think they put that ball back into school district's court, and it seems weird to me that children could go to Sunday school without a mask, but they can't come to summer school without a mask. So I'm going to listen to the other members and see what the motion on the floor will be, and then I will make my decision.
I recognize we cannot ever realistically expect 0% risk. In order to provide time to notify the public, staff, student families, I'd motion to amend the Milton Forward Plan, replace the current mask optional date from Saturday, July 3rd to Wednesday, June 16th.
I second that.
Could you repeat that, please, Dave?
Sure. I motion to amend the Milton Forward Plan, replace the current mask optional date from Saturday, July 3rd to Wednesday, June 16th.
There's a motion on the floor made by Dave, seconded by Leslie to amend the Milton Forward mask optional date and replace the July 3rd date to Wednesday, June 16th. Is there any discussion?
As I indicated when I spoke before, I think, to be fair to folks, I'm not sure a couple days is enough time. I guess I would offer an amendment to the motion on the floor to replace the June 16th date with June 21st, which is a week from today, or effective for Monday of that week, I guess. I would offer that amendment with the logic that I think a week isn't ideal, but it does give the families that and people that have made those choices some time to adjust should this pass. I'm not presumptuous that it is, but I would offer that amendment.
Is there a second to the amendment?
I'll second that amendment.
There's a motion for an amendment on the floor made by Joe and seconded by Jen to replace the June 16th date from the previous motion to June 21st. Is there any discussion on the amendment?
I guess my other comments is if that gets us to 4, then I support that.
Any other discussion on the amendment? All in favor of the amendment, say aye.
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 And opposed, nay. Nay. I'm gonna call for, roll call vote on that. Dave?
I vote yes.
Leslie?
Yes.
Joe?
Yes.
Rick? No. Mike is a no. Shelley? Jennifer?
Yes.
Motion passes, so now the amendment for the motion passes, so now the motion is that the Milton Forward Plan will be altered to replace the July 3rd date for mask optional to June 21st. Is there any discussion on that newly amended motion?
I would offer a couple more comments. Obviously, I'm in favor of the amended portion of the motion. Another thing I would like to reiterate is I think it's important that we're only addressing the mask portion of our COVID protocols. Certainly the relationship that we and the superintendent have had to navigate COVID has worked incredibly well, in my estimation. So I'm not advocating at all to remove any authority or discretion that Rich has to adjust based on conditions that change. And I think, and I feel even stronger that we cannot eliminate, for example, close contact notifications. If we have a positive COVID case and any of us were close contact, whether inadvertently or unavoidably, you would want to know that. So we cannot, it would be derelict of us to not notify folks that become close contacts if someone is positive. So I don't think we can eliminate that at all. I think one of the analogies that struck me before I came tonight was that while none of us has a crystal ball as far as what's going to happen in the future, we all have a rearview mirror. And as we look into that and look back on what we have made for choices as COVID unfolded, I'm really proud of our board and administrators and teachers and staff and students and families for the way that we navigated something that had no rules, and we basically made it up as we went along. I think it worked. I think we were able to find a middle ground and educate kids and do the best we could given the challenges and the circumstances we had. So when I get conflicted, I check the rearview mirror, and I think some of you have heard me say over time, when the choices are really difficult, the answer is probably in the middle. And for me, that's pretty much how I landed in this situation.
I have a question. How will this affect the policy that you mentioned, Mike, 8450?
That is a very good question. If you read the policy, I'll read it. It says, during times of elevated communicable disease, community spread, pandemic or epidemic, or a declared public health emergency, the district administrator may issue periodic guidance and procedures, the contents of which the district administrator will regularly bring to the board for review and potential action in alignment with public health officials and/or in accordance with government edicts, and including any pandemic plan developed by the district's pandemic response team under policy 8420.01. Later down, it says any PPE required other than face coverings will be provided by the district. Later on, it says, in addition, the board authorizes the district administrator to require that students shall wear a face covering unless they are unable to do so for a health or developmental reason.
So this amends that, is that correct?
Well, policy is policy, and we still have the policy. Mr. Downing, would you like to weigh in on that?
Yeah, I don't know that it changes anything in the policy. As Mike read, it gave the district administrator authority to incorporate requirements for the use of PPE, which I've done, and which the board also has approved. And it also, it authorizes the district administrator to require that students shall wear a face covering, but it doesn't require that happen. So I don't think that if this motion, where the amended motion passes, I don't think it violates that portion. And then it goes on to state that if face masks or coverings are required, and no exception is applicable, students shall be subject to disciplinary action in accordance with the student handbook. Again, if the board takes action to make masks optional, then that won't be in place because that's dependent on the mask being required. But I don't see any issue with a violation of this policy if the board takes action according to the amendment motion that we just made.
Thanks, Serge. Is there any more discussion?
I'm sorry, maybe I'm missing. So if with the passage of, making masks optional, is there, because this policy is still in place, are you saying that you're able to go back later on and add it when necessary? Is that how I'm reading and understanding it?
I think she's asking you, Rich.
This policy gives me the authority to make COVID-related decisions as needed. The process that we've used on that is when I've made COVID-related decisions, and I've been saying over the past 15 months on average, it's the average is not the best way to describe it, because at times I'm making 50 COVID-related decisions a day, and at other times I'm making 1 or 2 COVID-related decisions a week. But in general, there's a need in my consultations with our school nurse and our admin team and our public health to make changes. I think the next big decision that we would need to make as a district is what coming back in the fall will look like, and we've shared out that our plan is to bring a middle forward plan for the fall to the board on that July 12th school board meeting. So we would bring any updates there at that time. The board would either approve or not approve the forward plan for the fall.
Thank you.
just to be clear, the motion I made didn't suggest changing any of the powers that Rich has. It was simply advancing the date that we would go to masks optional. So since it was brought up, I just want to clarify that it wasn't in my words nor my intent.
There's one more thing that I want to make sure the board is alert to before they vote on this. If you recall, the two main reasons that I had shared about waiting until July 3rd to make this change were to honor the message that we've given to students and staff and parents about that first session of summer school and when that would take place. We do have additional summer school activities throughout July and throughout August. We also have a lot of other types of activities that take place in our schools, outside groups utilizing our schools, that type of thing, very often during the summer months. And so, as I said, the first is that honoring that message to parents and staff. The other is that opportunity for 12 through 17-year-olds to become fully vaccinated. As I shared earlier, that group that took part in our vaccination clinics that we did together with Rock County Health Department will be fully vaccinated on June 23rd. So fully vaccinated is considered 2 weeks after you receive that second dose. So just want to make sure that the board is alert to those things as they're making their decision. I do appreciate the amended motion because it does give us time to tomorrow, if this does pass tomorrow, we would message out to all summer school families that this upcoming change in procedures, and some of those families may need to line up different daycare or find something for their kids if they are sending their kids now and they decide not to. And I think a week is a reasonable amount of time for us to be able to get that message out for families to be able to make that decision. So I think that that's a better landing point than the original motion. But I wanted to make sure the board was alert to those two things.
I think it should be noted too that this is mask optional. So parents who want their children to wear masks can send their kids to school in masks. I don't think that we need to be careful that we're not creating a division. It is mask optional. So they still have those safety protocols in place. It's just we're giving parents, or we potentially are giving parents a choice.
Call the question.
Is there a second on it? Doesn't need a second, sir. All right, call the question. So I'm going to repeat and then we're voting. The amendment on the, or excuse me, the motion on the floor is to amend the Milton Forward Plan and replace the July 3rd mask optional date to June 21st. I'm going to do roll call. Jen, we're going to start on your side.
Yes.
Shelley? Mike is a no. Rick? No. Joe? Yes. Leslie?
Yes.
And Dave?
Yes.
The motion passes. And Rich, I'm assuming that you will do some sort of communication to families so they're aware of that. Thank you. For everyone who's out in the auditorium, you are certainly free to stay for the rest of the meeting. But we will not be offended if you choose to leave at this point. There's a lot more business that we will be undertaking. All right, moving on to number 3, a wellness update from Mike Catholic. We can't hear you at all.
You're good.
There we go. There you go. Okay.
So I'd like to say thank you tonight to all the community members, parents, and staff members, as well as the administrative team, who have volunteered countless hours over the past year to be on the wellness committee to make this a huge success. This past year, the committee focused on what we could do to get wellness information up to parents, staff members, and the community as a whole. In-house, the district's human resource department has been doing a great job of distributing to staff many different wellness articles and resources. To help facilitate getting more information out to parents and the community, the committee has recently been writing short articles and publishing them in the Red Hawk Review. The short article provides a quick description of that month's topic and then provides links which gives families the opportunity to explore more information on that topic. Members of the community also have access to the Red Hawk Review through the district website, so they too can access the wellness links. This year we also managed to get our own wellness tab out on the district website, and over the course of this next year we'll be looking at what we want to put in that tab when people click on it. So that's kind of our goal for this next school year is to decide what we want to put in there. We'll probably be putting the articles from the Red Hawk Review in there, so people always have reference for them. So our next meeting is August 11th. That is a Wednesday evening, 7 o'clock down in the district office. So anybody is welcome to join us from the community, staff, and board members.
Thanks, Mike. Does anyone have any questions for Mike?
Thank you.
Thank you. Item B, annual health services report from Brittany. Coots.
Correct, yep.
Nice to see you, Brittany. Thanks for being here tonight.
Thank you guys all for being here too and reviewing my report. I do want to do a quick overview of the health service team and what important role that we play here in the district. We do a variety of tasks with me and our health aides, we have full-time health aides, and we get a lot of support from each school, the candidate assistants, paraprofessionals. Particularly the health team, first and foremost, we get them care to students and staff that need it. That includes coming with physical injuries, illnesses, then as far as like mental and health support too. I think kids that come in anxious and find different ways to support them. And we do also create individualized healthcare plans for students with medical conditions. That includes specific details of their plan of care in school, make sure they're safe, they have everything that they need, communicate with families and schools, and even other medical professionals from hospitals and clinics in local areas to are safe. We generate confidential health lists for each school every quarter, so the school is aware of health needs within that school, so they can, if any kids are questioning for needing health plans, we can look back and see if that's appropriate for them or not. The healthcare team also consults with other services such as nutrition services or social workers in the school. At times, we work with them with something else, or we just want to support our families in the district and any students that need it to provide annual training for emergency basic medications. It's an important role too to make sure those things are done safely and efficiently for all of our students. It goes far too as medication audits, making sure that medications are given and documented appropriately within the district. And there's accident reports for students, make sure we review those, make sure actions are taken appropriately. We also help serve as a coordinator for the district to make sure that they're functioning correctly, monthly checks on them, replace those units when needed, and check on the health accessories. We also do immunizations each year, so we make sure how many compliant and non-compliant students we have in the district, get the report ready for the health department, and continuously reviewing that information and gathering any waivers that are needed or updated records too. gonna move forward, page 2. So just again, just a quick overview of health staff. Again, is me as a nurse, I'm here full-time, 2 full-time health aides, and 1 part-time health aide, perhaps help for additional support. Any questions before I move forward? I just want to highlight some areas with a little bit more detail. All right, so the first section I want to jump to is on page 3 under office visits. I think this is really important to talk about because it's not just something that our health team does, but also the admin assistants, so this is something that they help us with. This also consists of a large part of the general health services that we provide in the district. It's obviously you're going to get sick, and even though walking's put in place, kids do get injured at school. Someone needs to be there to make sure those kids are okay, check on their well-being, and take appropriate interventions. At the high school level, my main office is here, so a majority of the time I'm here to travel to all the schools. North side and west do have health aides that are full-time there, so they so you see a lot of kids that go to school for office visits. But again, at the other schools that don't have a health aide available or be available there, the admin assistants do take a lot of that responsibility. The chart below, I wanted to compare office visits not to last year, but to the 18-19 year, because that was the last, I guess you could say, quote, normal year that we had. So I wanted to get the most accurate data we had for a normal school year and then compare to this year. It's not surprising that office visits were down from a normal year. Surprisingly, we had virtual kids. We had periods where there were no kids in school for the virtual sessions. Middle school and high school had a period of time where their kids were cohorting, so they're every other day. There is a significant decrease in some of those schools, which again is not unexpected. Any question on the office visit section? And then just something to add on quick for the office visits, to make the office visits. It may not seem significant that a lot of kids come in for headaches, stomach aches, these are the 2 most frequent health visits, but I do want to just say that some of these headaches do come from a variety of different reasons. I myself at the high school level experience a lot of kids coming with those symptoms, and once you get really talking to them, because they could relate. Again, this is just my high school experience here. I can't speak for the other schools, but they feel anxious. And so really, it's just you have to really investigate those symptoms, not just look at just coming in for a stomach ache and just thinking, oh, you gotta think outside the box and really get down to why these kids are feeling that way, so then they will end up wanting to go back to class and keep them as much as possible, and not have them wanting to go home. Some interventions in place to actually help them better. And I'm going to go down to the next section if there's no questions. Just want to highlight some of the significant health concerns or conditions that students have and the number within the district. I think it's important to note too, because there's a lot of extra stuff that goes along with students and their certain health conditions too. We currently have 29 students with allergies that require treatment, so they have a history of anaphylactic reactions. 36 eating disorders, 6 diabetics, 234 listed students with asthma conditions. And I wanted to note that too, because again, like I said in the very beginning, some of these individuals need individual healthcare plans. These are plans that we collaborate with the families, the doctors, make sure these kids are safe, so then we can pass it along to the schools and teachers to make sure they know their exact plan and know what interventions it's needed. Total in the district, we have 79 students with healthcare plans. That's a continuous process that we're looking through, identifying kids who may need them, and creating that plan too. So, and those plans ideally should be updated yearly, or at least contact the families to see if those plans need update. Any questions on the healthcare plan section? I'm just going to do a really quick overview of medication administration. I want to point out that anyone who's administering medications in the district does have to be trained by myself and checked off for competency. Anything other than basic medications does need that hands-on skill training. So that does take a lot of extra support from our healthcare team too, just to even set up those health trainings, making sure those individuals feel confident when they're administering these medications before they're actually signed up. So some individuals I'll do multiple hands-on training just to make sure they feel really good about what they're doing before they let them go and do that themselves. And I wanted to point out too, just because this can take a significant amount of time. It doesn't seem like we'd add up to this, but throughout the school year, we have 33 students with scheduled medications. Over the entire year, that equaled 3,779 number of scheduled medications administered. So when you think about it, even if each of those medications administrations took a minute, that's a lot of minutes that goes towards that. And that's not just the healthcare team too. Health aides do that at their schools. reminder set out in July of 2020, but again, there are a lot of barriers, and worry that cause families to not vaccinate their child. By the time the state report was due, we were down to 43 from 135 non-compliant TDAP immunizations. There's a lot of work done here. And again, this was through the required mandatory letters that were sent out and phone and email as well. So we did a lot of work to contact families and get the percentage right there. Any questions on the immunization section about waivers? And if no one has objections, I'm going to skip forward to COVID-19 data. I know we've all heard a lot about COVID-19 this year, probably have heard more than we ever wanted to. But I do want to highlight this section because of all the work and all the extra things that the staff had to do regarding COVID-19. We didn't have extra help to help navigate through the pandemic, so a lot of our staff, healthcare team, schools took on extra responsibilities in order to navigate through this. Some of those tasks included, so bringing a review of the COVID guidelines and policies. Each school and the district office had a spreadsheet that was related to core tracker to keep track of positive individuals. Those were quarantined, and those that had symptoms specific to COVID that were getting tested or in quarantine for that as well. And that was something that the healthcare team helped monitor too. So not just each school, but we were all a part of that, helping monitor the entire district. We also helped with contact tracing. Each one of those 288 known positive cases, contact tracing occurred for. And then the individual that was listed close contact, we would contact all those families for quarantine measures, quarantine guidelines, explanation. And I apologize, I do not have the number of quarantined individuals in my data. Actually, in Wisconsin, the school nurses had access, or granted access this year for WEDS, which is Wisconsin Electronic Disease Surveillance System. That allowed me in particular to look up staff receiving test results, and this was just for COVID only related to our staff and students. So the families were having a hard time getting the school the test results or hadn't heard their test results. I was able to look that up for them and verify if they were positive or negative. There was a lot of explanation too from the healthcare team and each school, just providing families and staff with COVID-19 information, updated guidance, going through, what to do if your child has certain symptoms, determining if a child was in need of COVID-related guidance or if it was just a particular illness that they needed to stay home the next day. A lot of families and staff even too followed and were asking those questions. So that was almost actually, that was pretty much a daily thing on our end. And again, we worked very closely with Rock County Health Department. I also work with the Ford Healthcare School Nurse Group, which I am contracted through. We worked together very closely on specific situations, reached out when there were particular questions that I wasn't able to answer myself, and did a lot of teamwork that way too. And then if you have a chart in front of you for the positive cases, trimester 1, which went through 9/1 to 11/24, we had 130 total positives. Trimester 2 went down to 104 total positives, and then trimester 3 is 54 total positives. That's staff and student combined. I did break it down further just to keep some confidentiality, and protect those who were positive. Just some other celebrations I think that should be mentioned. I worked with the tech team this year. Skyward is our system that we use for health-related matters. It isn't always user-friendly, so we work with the health department to make some of the data and the spreadsheets that we use frequently run smoother and more efficiently. It doesn't sound like a big thing, but when we're able to run reports and finalize them within minutes versus having to go back and format them and try to figure out the correct configuration for them, it takes us a lot of time. And then I know earlier two vaccination clinics were mentioned. Milton worked with Dean Health, Mercy, and Rock County Health Department in setting up several different vaccination clinics. For influenza clinic, Human Resources took lead responsibility on that, the healthcare team did assist when needed on that as well. And then the COVID-19 vaccination clinics were collaborated by me and our administrators. We were able to give them a location to open their clinics and provide our families if they wanted the opportunity to do that here at school. And then just one final message, the healthcare team is always continuously looking forward to making improvements to our systems, protocols, and processes to help make the district run smoothly, especially within the school. Our goal has always been and enforce health and safety while we promote our staff and students. Thank you very much for listening to my report, and please feel free to ask any questions that you have.
Any questions for Brittany?
Just one quick comment and a quick question. Brittany, first of all, this was a very comprehensive report. Thank you for putting it together. Appreciate all of that data. Obviously, a great deal of time went into it. I don't know if this is a question for you or Rich for you, but if the CDC lowers the eligible age for vaccinations, will we have a clinic here over the course of the summer to provide an opportunity for kids of a different age group, should that come to pass, to be vaccinated prior to the start of school?
I can answer that in general, and if Brittany has more specific details, she can chime in. I think the likelihood would be that we would follow the same process that we did for the 12 through 17-year-olds, and that was to work with Rock County Public Health Department. They didn't offer those clinics at every school across the county. It was dependent on vaccine availability and the expected desire in those communities. So it wouldn't be a given that we would offer it, but we'd be open to working with Rock County Public Health Department. Brittany, anything else to add to that?
Well, I agree. They reached out and thought that we had maybe the ones like you said that we would talk about that at that time.
Thank you.
I just had one quick comment. Having been on the board a few years and heard these annual reports, thank you for the report. It's extremely competent and professional. Perhaps in no year prior to this has student health been more of a focus. And please accept our thanks and congratulations on a competent, professional, compassionate job coordinating everyone's efforts to address all the health issues that all of our kids face. So thank you, thank you, thank you.
Thank you.
I just want to echo that. Thanks for all the info and for sharing that. I know your job is hard in a normal year, and I'm sure it was even worse this past year. So thanks for all you've done and for helping keep all of our students and staff safe. Appreciate it.
You're welcome.
Thanks so much, Brittany. All right, moving on to item number 4, Finance Committee report. Mr. Martin, I will turn it over to you.
Okay, our Finance Committee met last week, Monday I believe it was, and I'm going to have some assistance from Carrie and Mike Gosdeck. I will talk first on behalf of Stephen Shantz, who is unable to be here tonight, but Stephen and I conversed, and I will summarize that discussion at the committee level. And that's letter A, facility maintenance and improvement plans. And while we did not have any documents to share with the board that detailed any changes to that, Stephen was bringing it to our attention to emphasize the fact that we do have an ongoing process whereby capital improvements and maintenance land on a 5 or 10-year look, or window to look at, I guess if you will. The 5-year is probably more pertinent. We have needs that we know we need to address, and Stephen and his team do a job of prioritizing that and scheduling those such that they fit within our budget. I know we work closely with Carrie Bradley to determine an amount each year that we can allocate towards those types of expenses. And then when we find needs that sporadically might exceed our ability to address them, they live on the 10-year documents such that they're not overlooked or not forgotten, but they're there, and we find opportunities to address those as we can. So there are no new information relative to that. Stephen will present an annual update for us that shows what's on that 5 and 10-year window or document, if you will. But just wanted to keep us apprised as it's a work in progress. They call it a living document. Things get added, things get subtracted as our needs change. So I will ask Carrie and Mike to step in. They each have a component here for the other pieces of this agenda. And I don't know who's going first. Mike's got his hand up. B says school nutrition program. And I will let him share with you finance-wise what's relevant for that.
Thanks, Joe. So you guys have the memo, your documents for the changes I'm making to the school nutrition program for next year. So this kind of to highlight that, why we're going to do breakfast in the classroom, right? For this current school year, with the USDA providing free meals for all students for breakfast and for lunch, we saw breakfast participation increase 37% previous school years. During that same time, we saw milk break decrease by 18%. The correlation with that is naturally they just had breakfast at 8:45 or 8:30 in the morning, and then to have a milk break at 9:15, 9:30, depending when the teacher wanted it. They actually weren't thirsty for their milk break. So with the USDA approving all students' ability to free again next school year, I decided to take advantage of that and bring breakfast to the classroom. So we'll be able to serve more students in the classroom than we can in the dining rooms before school. So more students will have access to breakfast. The students will have more time to eat breakfast because they'll be able to eat in the classroom. Where this current school year, a lot of them had to eat at the gym or the dining room and had to try and get to class sometimes, so they didn't have a lot of time. Participation being so high, we weren't able to get them through the lunch lines quite as fast or breakfast lines quite as fast. So this process will be more efficient for the nutrition team and the custodial staff, as well as the teaching staff. And students will be offered a full breakfast and no choice. They will not be required to take them. And then the only other thing is we'll make sure that we'll be working with parents, with those students that have allergies, to make sure that we do have alternative breakfast components available for them. So, any questions?
Just one quick question. It's not clear to me what putting the Wisconsin School Day Milk Program on hold means. Is there still milk available for lunch and presumably breakfast as well? It wasn't clear to me what that meant.
Yeah, so currently this past school year, we had 3 programs that we run. We run the breakfast program, National School Breakfast Program, National School Lunch Program, and the Wisconsin School Day Milk Program. So the breakfast program, the way we were running it was always before school. And then Wisconsin School Day Milk Program was like mid-morning, was when the teachers would do the milk break, and then we did the lunch program. And a few teachers did afternoon milk break, but it was very low. So with transitioning to breakfast in the classroom next year, it's going to be too hard to do both programs at the same time. Because we're giving the teachers the flexibility to offer their breakfast to the kids anywhere from the start of school up to 10 o'clock in the morning.
Okay, so the student has the same opportunity to have a milk break. It's just relabeled essentially.
Essentially.
Okay, thank you.
Yep.
contributing to that whole. That is affecting your state here, state, will see, if we heard, purchasing the same amount of during the breakfast and free lunches that are offered.
No, kids are taking milk, quite often. I think at the high school level, we see a decrease in milk consumption. We have a lot of kids that come through and don't choose the milk at the high school level, but the smaller grades, the kids usually have take the milk. It's available to them. So, milk consumption, I'm anticipating with the breakfast, we're gonna see an increase in breakfast participation, and milk consumption, I'm anticipating should stay about the same, as currently with Wisconsin school day milk. Can you turn on your mic?
She's muted.
Oh,
Just tap the bottom.
Time before. I'm just thinking of hundreds of schools across the state suspend their milk program. Our state.
yeah, that's a good question. And that's why we're putting on hold this year. We don't know what the USDA is going to do for school year 22-23. So, we'll review this in the spring and see if this was a success for breakfast in the classroom. And if it wasn't, then, we'll transition back. The USDA continues free breakfast and free lunch, which they're looking into currently. Then, we'll just have to review the Wisconsin school day milk in the spring and see if our milk consumption is where it needs to be. So, to support those dairy farmers out there.
Any other questions for Mike? Thank you, sir.
Yep.
Okay, letter C is discussion and possible action on 2021-22 school year fees and meal prices. And I will let Mike and Carrie, if need be, give you a little of the background there, and then I'll offer a motion when they're done with what they've got to update us with.
So I'll go first again. You have the memo that I sent out, the reason for the price increases, but just to kind of highlight things again. So even though all students will be able to eat for free this next school year, when we return in the fall, we want to increase the prices to maintain that paid lunch equity, which helps to ensure that federal funds intended for students that qualify for free or reduced lunches are not getting paid student meals. This will also help to ensure that we're not charging less for school meals than it costs us to produce each day. So if we come back in school year 22-23, this will kind of keep us where we need to be with that paid lunch equity. The price increases for not only students, but for staff as well. Any questions on the food service fees increase?
All right, I indicated I would do a motion. I should point out, the motion will cover school fees in aggregate and meal prices. There's a couple subtle changes. I think the easiest way to describe it is the fees are the same, except we're proposing from the meal price increase that Mike has suggested is one piece, and then on the fee side, the optional device insurance relative to our laptops and iPads and so forth, based on Ryan Perlis's recommendation to stay current with actual repair cost and those types of things that the district incurs. He's recommending a small increase in the insurance that folks are eligible to purchase through the district, which is included on that memo sheet there. Have I captured that correctly?
That is correct. And then, in the after meeting, I had mentioned that the middle school yearbook.
Get close to the mic so we can hear you, please.
Oh, I kind of startled myself. So after the committee meeting, I had mentioned that the middle school yearbook was also looking at an increase.
Yes.
Received that information. That would be the only thing I would add to what you're saying is
We're looking at increasing the price from $33 to $35, again, related to cost.
Yeah, I was remiss in missing the yearbook. So if folks have additional questions, please bring them up. But I would offer a motion to accept the 2021-22 school fees and meal prices, or to adjust those as presented.
I'll second.
There's a motion on the floor made by Joe, seconded by Leslie, to approve the 2021-22 school fees and meal prices as presented. Just to clarify, then that's the cost of increase to the student and staff lunches, the cost of increase to the device insurance, plus the cost for the middle school year, what was it?
Correct.
Yeah, thank you. Any discussion on that? All in favor, say aye. Aye. And opposed, nay. Motion carries.
Okay, then the second part of our discussion that Carrie will help us with is budget related. She's going to share a little information on current budget and then the process for where she's going with next year's budget.
All right, you pass the ball to me now, is that right? So, if you recall, last October, the board adopted a budget, and we are nearing our year again with that budget, and at this point in time, I do anticipate we will have a surplus. So the point of the memo today is to be ready and informed of the decisions that you may need to make at the next board meeting. And then also just an opportunity to talk about what fund balance is as well. And so as you go through the memo, I have indicated, I have a line in there that just describes beginning fund balance plus revenues plus expenses equals your ending fund balance. So when we have a difference in the revenues that we receive, if we have a shortfall, that's going to reduce fund balance, all things being equal. And with regard to expenses, if we expend less, that will likely in that formula increase our fund balance at the end of the year. As I look at this year's budget, we do have a shortfall in revenues, and those are related to field trips and admissions for extracurricular activities, which makes sense when we look at things that have happened this year. But I'm also planning on a reduction in expenditures as well, as far as what we planned compared to what we're likely to experience. So if we are anticipating having a surplus, some decisions need to be made. And those decisions can be around leaving whatever surplus we have this year in fund balance. And as we talked last year, if we do something like that, it will improve our financial position. It may reduce our need for cash flow borrowing, because if you recall, our expenditures don't align with our revenues. And so we need to cash flow borrow. And the more fund balance we have that's composed of cash helps us avoid that borrowing. It also improves our ability to respond to unexpected needs. And one of the reasons last year that we had the surplus build fund balance was because we weren't sure what this year was going to look like. We have been quite successful in meeting needs within our current budget for the most part, as we go through the year. And then the other thing that fund balance can be used for is to respond in changes in revenue from one year to the next. As you know, we have to start planning our budget before our fiscal year begins, and every other year before the state budget is determined. So if we have enough resources in our fund balance, that gives us a little more flexibility if we need it while we're doing our planning for the year. Another option would be to transfer funds to the Capital Improvement Fund 46, which we created last year. There are 4 years left on the waiting period before we can access those funds. Or you could look at a combination of both of these options. One thing I've added to our conversation that I haven't talked about in the past is another thing to consider is that every year when we talk about fund balance, we talk about it as a percent of our expenditures. And as our expenditures grow, we might want to think about having our fund balance grow a little bit as well too. So that when we look at that relationship between revenues and expenses, it will be a reflection of our financial position, and it will maintain, if not slightly grow that. So next board meeting, when we finish working out the budget, we will bring back the decisions need to be made. Did you have any other comments on that for the committee? Questions?
Carrie, we're gonna be making these decisions while the state budget is still far from being passed in light of some of the proposals in joint finance. While I think it would be good to put some money into the capital improvement fund 46, having the overall focus more so on the general fund. I don't have a ratio in mind, but just that logic in place would be my opinion with what's publicly available now. I don't know if you feel otherwise or have an opinion at this point.
We always hope that more information will become available, and I have learned to live by to make the best decisions we can at a point in time with information we have. So, I'm kind of on the, let's see what information we have when we meet next. The state level conversations, I try to be cautious in speculating too much, but when we talk about next year's budget, I'll tell you the assumptions I made and how they haven't happened yet. So, just another way to think about the state budgets.
No other questions, go right ahead to D then, or E, I'm sorry.
Okay, E. So, we've been making decisions, the board has made decisions, budget managers have made decisions in the past several months. And so I'm in the process of basically working with staff to put together a budget that reflects all of those decisions. What I wanted to do was talk a little bit about how our budget is structured and how the world works as far as how we're set up. And people have been working on the expenditure side of the budget, but I also want to talk about the revenue side, and especially talk about controlled revenues. Every year we have to estimate our revenues before our fiscal year begins, and in some cases before the state has determined how much revenue we will be allowed. And the revenue limit calculation is key to the majority of our revenues, and we know that we're going to do an estimate for the third Friday come in the fall, but there's also some increments that are in the formula that we've reviewed in the past, a per member increment and a low revenue increment. And so we are in the process of waiting to see what's going to happen with our revenue forward. But at a very high level, without applying any reductions to our budget, we can generally expect our overall budget to increase 2 to 3% per year. And the revenue limit authority, we are hopeful that it will keep up with growth, but if we look at history, sometimes it has, and even perhaps surpassed what our growth would have been, and other times that's not the case. So, given the current action or the most recent action, the Joint Finance Committee passed a motion that there would be no increase in our revenue limit authority or our revenue per pupil. So we were looking at fairly flat increase in revenues. They continue to have conversations, there's new information available, but we are waiting to see. But when that happens, we met as a central office team and decided that while we're waiting for this to conclude, we were going to put on hold the process that we were going through with regard to determining the uses of the ESSER funds. As we had shared with you at a prior meeting, we talked about the 3 different funds, or 3 different packages of federal funding that were available. And so we're putting that on hold until we have a better picture of what is likely to happen. And I think maybe that's part of our thinking as well next year. So we'll put that on hold. But we always need to be mindful that we are talking about one-time funds. These federal funds that they're considering are one-time monies. And they're not annually increasing, like an increasing the revenue limit. So, things have been put on hold. So what I'd like to do at a very high level is just kind of paint a picture of what's going on, with our revenues and expenditures. So if you go to the very first pie chart, please. Thank you. Okay, so at a very high level, the first thing I did is, and this is not typically how we look at the data. I combined funds 10 and 27, and I took out interfund transfers. But at a very high level, you can see that almost half of our expenditures are on wages, 15%. Another almost 22% is on employee benefits, and again, about 22% is for purchase services. That purchase service bucket is very large, but those are at a very high level our top three expenditures. If you go to the next pie chart, the next thing I did is I took our larger expenditures to see, instead of just doing the object sort that's in the system, and I pulled data out. And again, wages is highest, followed by medical insurance, open enrollment tuition, and then transportation and travel, utilities, and purchased instruction. Now, purchased instruction tends to reflect substitute teachers or other professionals that we purchase services from rather than hiring. And it can also include tuition as well. So there are times when we do pay tuition. But I kind of wanted to let you see where our big expenditures lie. And then the other, as I have on the bottom of that chart, the takeaway is that overall, if you look at this, approximately 80% of our expenditures tend to increase every year, cost of them. And 65% of our budget expenditures are for wages and medical insurance. So then if we move over to the revenue side, revenue comes primarily from 5 sources, and those sources are listed. Local sources, the majority of that is the tax levy. We have open enrollment revenue for students that attend here, and then we have revenue sources from the state. The first pie chart then just shows the breakdown. But the second pie chart, if you recall, last year we started talking about revenue limits and this idea of controlled revenue versus uncontrolled. And if you recall, the revenue limit controls the tax levy and general aids. So if you look at controlled revenues compared to revenues outside the limit, you can see that 81% of our revenues are controlled. And then the last page just provides some detail on the revenue limit formula. So when we're talking about controlled revenues, to me that equals the revenue limit formula. All right, and as we had talked before, base revenue, or prior year's revenue, are what one of the key pieces in that formula. Membership, which is resident full-time equivalency, and that's measured in the fall for summer school. And then we have the per member change and the low revenue increment. And those are two things that initially, when this first started, were intended to keep pace with inflation and kind of provide a predictable growth in the district's revenue picture. And that was back in the 90s when it started. And the number has changed over time, but the historical perspective to me, that it will be predictable and you will keep pace, is kind of sunset. And now it's a piece of the overall revenue picture. And the formula tends to get used to control property taxes, which is what it's designed to do. But but this expectation of increasing that he used to live doesn't really, hasn't been reflected in recent history. So to project our budget for next year, you need to make an assumption. So if you look at that longitudinal analysis, what I did is you have 2 years, 2 years of history, current year, and then two projected future years of running the revenue limit formula. And you can see in 2019, our per member increase was $91. In 2020, it was $300, and in 2021, it was $284. That increase is a combination of that per member increase and the low revenue increment, because we are a low revenue district. So to cast it forward, I did not increase the low revenue increment and just put in $150 in each of 22 and 23. If you go to the very bottom, you can see the percentage change from the prior year. And you can see that we're looking closer to a 1% change in our revenues with that $150 increment. Now we will have to wait and see what happens with the legislature. There's also categorical aids that are paid outside the revenue limit that we can anticipate. But historically, the majority of our revenues have come from the revenue limit calculation. So I just want you to have a takeaway, to be aware of the challenges of balancing 2 to 3% increases in expenditures, when it looks like our revenue increases are going to be closer to 1%. And kind of what that means to balance the budget is that we need to reduce expenditures, which can be translated into making cuts. We do have work that has been done to reduce expenditures for next year. And so some of that, we have done some of that work, not only to be efficient and effective with what we do, but in anticipation of the likelihood that we would have to reduce our expenditures overall, or the growth in our expenditures. Did you have anything you wish to add or any questions?
I don't have a question, I have one comment, and I shared this at the committee level. As I've learned over the years more and more of the complexity of this school finance puzzle, different little pieces stand out once in a while. And one of the curious takeaways that you saw there on the slide resonates loudly with me. In our efforts to help our community understand the challenge of balancing a school budget, please share as you can that idea that 80% of our expenses are things that go up every year. And that kind of, to me, resonates loudly, the challenge that we face. We get expected and should be expected to live within our means, but that's the challenge is can we have small increases in revenue and small cuts in expenses to make that situation balance when 80% of those costs are typically expected to go up in any given year. So I think that just resonates loudly. But thanks, Gary, for that. Any questions beyond? And that concludes the Finance Committee, Mr. President.
Thank you, Joe, and thank you, Carrie. I always appreciate your attention to detail and the time and effort you put into keeping us informed and your expertise. Moving on to number 5, Human Resources Committee. Mr. Mullen, I will turn it over to you.
Thank you, Mike. The HR committee met on June 7th. Our first item is discussion of possible action on 2021-22 staffing updates. This is kind of 3 different items rolled into one. I will start with the 2021-22 recommended staffing baseline for the professional staff. The administration has reviewed the staffing needs, and the HR committee is bringing forth staffing level recommendations as outlined in the attached memo and board docs. As you can see, for the professional staff, there are currently 255.44 FTE for the 2021-22 school year. Back on May 10th, the board approved a 0.26 FTE at Northside. And on the May 24th meeting, we approved a 1.0 FTE school counselor at the elementary level. The administration is also recommending a 1.0 FTE alternative education teacher for the high school, and this will be funded by the ESSER funds. This is a one-year position which will be used to teach the high school virtual students. This brings a total FTE for the 2021-22 school year recommendation of 257.70. For the administrators and supervisors, there currently are 24 FTE approved for the 2021-22 school year, and there are no changes recommended for this group. Thus, I would like to make a motion that 257.70 teacher FTE and 24 administrative and supervisor FTE be the professional staffing baseline used for the 2021-22 school year. Any additional FTE not listed in the baseline will be subject to board policy 3111 and brought forward to the board for review and possible approval.
Second.
There's a motion on the floor made by Rick, seconded by Joe, that 257.7 teacher FTE and 24 administrative and supervisor FTE be the professional staffing baseline used for the 2021-2022 school year. Any additional FTE not listed in the baseline will be subject to board policy 3111 and brought forward to the board for review and possible approval. Is there any discussion? Hearing none, all in favor say aye.
Aye.
And opposed, nay. Motion passes. Thanks, Rick. Next.
Next is the 2021-22 recommended staffing baseline for the support staff. Also outlined in the memo, the administration is looking to start this coming school year with the current number of FTE 173.48. Also outlined is the administration's request to approve an additional 5 FTE, and the HR committee is recommending this for the total staffing baseline of 178.48. This additional 5 FTE would allow the administration some flexibility and the opportunity to fill positions quicker prior to board approval, and to allow them to take care of student needs quicker when needed. Also outlined in the memo is the fact that the policy committee will be looking into reviewing policy 4111 at our next meeting, which pertains to the board approving new positions before they can be filled. This kind of gives the administration a little cushion, if you will, so that they can hire new staff faster when they need to. So I would like to make a motion that 178.48 support staff FTE be the staffing baseline used for the 2021-22 school year.
Second.
There's a motion on the floor made by Rick, and I believe seconded by Jen, that 178.48 support staff FTE be the staffing baseline used for the 2021-2022 school year. Is there any discussion? Hearing none, all in favor say aye.
Aye.
Opposed, nay. Motion carries.
Okay, next is the 2021-22 summer school staffing baseline. The summer school for the 2021-22 covers July 21, August of 21, and June of 22, because it all falls on the same fiscal year. The anticipated needs listed are based on the needs from the July and August of 2020 and June of 2019, because there was no June 2020 summer school. It's a little confusing. If any additional hours are going to be needed, that would come to the board for approval. So I would like to make a motion that the number of instructional hours not exceed 9,750 and support staff hours not exceed 5,500 for the 2021-22 summer school program. Any additional hours not listed in the baseline will be subject to board policy 4111 and brought forward to the board for review and possible approval.
I'll second.
There's a motion on the floor made by Rick and seconded by Joe that the number of instructional hours not exceed 9,750 and support staff hours not exceed 5,500 for the 2021-2022 summer school program. Any additional hours not listed in the baseline will be subject to board policy 4111 and brought forward to the board for review and possible approval. Is there any discussion on the motion? Hearing none, all in favor say aye.
Aye.
And opposed, nay. Motion carries.
Okay, next up is the Horizon Health Insurance Study, which was included in the board docs. The entire copy of that is 60 or 70 pages. You can take a look at it if you like. This was a study that was done by the Horizon Government Affairs Lobbying Group. Earlier this calendar year, school districts throughout the state started to receive information related to the statewide pooling of school district employees for health insurance. This Horizon study is modeled off of the current state employee pool, the uniform benefit plan that would require districts to enroll in a high deductible health plan with a partially funded HSA, kind of like the one that we started to offer last month. The study has claimed that it can save somewhere between 250 and 500 million in premiums if all districts join the pool. There are some limitations within the study that need to be addressed, however. For one, the plan and claim savings suggest that the plan design will address all Wisconsin school districts, kind of a one-size-fits-all concept, which isn't very reasonable. And also, in my opinion, the study focuses entirely on the cost. It does not really focus at all on individual districts' benefits, compensation, and culture. Al Yeager from USI has shared with the committee that the timing really isn't urgent and that the accuracy of the study is being explored. Al also shared that the State Joint Finance Committee has removed funding for this study at this time, so there really are no next steps that may be taken, at least not right now. This is all kind of just an FYI for right now, and if any more information becomes available, we will bring it forth to the board. Does anyone have any questions or comments at all about this?
Yeah, I have a comment on it. One, like you said, it is a lobbying group, and there's a question there. And the other assumption is much of the study is the assumption that Act 10 was good for our state in 2010, and I would debate that and whether everyone thinks it was positive for their state and what's happened to our public school districts and our state employees.
Anything else? Anyone? Like I said, that's just kind of an FYI. We'll keep you posted if there's anything else. And the last item is the staff handbook update and timeline. The HR department will be working on this in the coming weeks and months, and we'll hopefully be getting the staff handbook updated sometime this fall. And I will also keep you updated on that. And that's all I have.
Thanks a lot, Rick. I appreciate it. Moving on to number 6, miscellaneous. Letter A, action on staffing reports.
I'll make a motion to approve the staffing reports as presented.
There's a motion on the floor made by Rick, seconded by Leslie to approve the staffing reports as presented. Any discussion? All in favor say aye.
Aye.
And opposed, nay. Motion carries. Moving on to B, action on gifts and donations. There are quite a few. I just want to point out the first one is the Herb Cole Educational Foundation. There's a little bit of a typo there, in case anyone was wondering what Herb Cole is.
I'll make a motion to approve the gifts and donations with gratitude.
Second. The motion on the floor made by Rick and seconded by Leslie to approve the gifts and donations with gratitude. Any discussion?
I just want to mention real quick, since you guys have been mentioned already here tonight, but that new pool is just fantastic. I know a lot of us were here yesterday for that opening, so Just thanks to everyone for that. It's awesome.
Yeah, I second that. It was a great day for the Leader family. It was a great day for the Mill community. I also want to thank everyone that was involved in that and also that were involved with the prom on Friday night. I just saw pictures on Facebook and things like that, and it looks like the kids, it was really unique, and they got to have something that was unique and different for them, and I know that was a huge undertaking for the staff to do that also. So thank you guys, staff.
I would say that pool is an awesome addition to the district, an awesome addition to this community, and the Leader family is a great family, and Tom has done so much for the swimming program in our community, so kudos to everyone. All right, meeting dates. Mr. Dahman.
Mr. President, you need to vote.
Did we not vote? I am so sorry. That's what happens when someone gets me distracted. Back to the, sorry, Mr. Dahman. All in favor of the motion to approve the gifts and donations with gratitude? Aye. Mr. Aye. Aye. And opposed, nay. Motion carries. Thanks for that, Joe. Back to meeting dates, Mr. Dahman.
The only committee meeting that we need to schedule is a HR committee meeting sometime between now and the next board meeting on the 28th.
We're still working on that. I'll be in touch.
Okay, that sounds good. And then the next regular board meeting is on June 28th. We'll be back at the district office, regular meeting spot.
All right. Next, we're going into executive session. I'll need a motion to go into executive session for state statute 19.85, sub 1, sub C, sub E, and G, considering employment, promotion, compensation, or performance evaluation data of any public employee over which the governmental body has jurisdiction or exercises responsibility, deliberating or negotiating the purchasing of public properties, the investing of public funds, or conducting other specified public business whenever competitive or bargaining reasons require a closed session, conferring with legal counsel for the governmental body who is rendering oral or written advice concerning strategy to be adopted by the body with respect to litigation in which it is or is likely to become involved. And this it has to do with administrator compensation and Huffman Facility Development Incorporated contract amendment and a vaping litigation.
Also move.
Second.
Motion on the floor made by Joe, seconded by Rick. You will do the roll.